So with that being said, I'm just going to ask Junie to start recording. Thank you. And you'll all just get a little prompt that will let you know that the recording has begun. So thank you, everyone, and just want to officially welcome you to our 5th session. I can't believe we've come this far. We're nearing the end with a few more sessions to go, but today here we are at session 5. I just want to introduce myself first. I'm your facilitator for today, so I'll be opening and closing the session. My name is Michelle Marcineau. I'm the research lead who works with Dr. Carrie Kolesky on her patient experience research portfolio. You might recognize me if you've attended previous sessions. I'm the one who's usually emailing with you or corresponding with you, and working really hard with Junie, another one of our team members, to work in the background and hope that everything goes smoothly. So today our session is going to be focused on preparing your engagement activities. And we're going to have a focus in this session on, the preparation parts of it, thinking about the recruitment, the onboarding, preparation of staff, community, and patient and caregiver partners. I do just want to mention, as I had in our registration email, that this session is going to be a bit content heavy. So we just want to say that up front. And it's designed in this way because we do feel that there's a lot of important information and thinking about how to prepare for your engagement activities. And we want to make sure that we give you all that information and those tools. And then that actually sets us up for our next session in May, which is going to be focused on engagement methods. And we're actually hoping to design that one to be a lot more interactive. For example, maybe using breakout rooms and things like that. So if you do have a chance to stick to the end of today's session, we do have a feedback question where we do want to get your advice about what you would want to learn and test out in that next session. And that will help us design that for everyone. So just some quick housekeeping. As I mentioned, if you're just logging in and you want to introduce yourself in the chat, it's a great way just to connect and see who's in the room. You've noticed that we're recording the session today, and I am just going to say, if you turn off your video camera, that way, sometimes the videos do show up in the recording that does go online. So that's just a way to ensure that you don't show up. We are hoping to fit in some Q&A later on. So if you do come off camera or you come off your mic, just an FYI that you will be, it will show up in the recording. We've also had in past sessions some people say that the chat can be very distracting. So if you look at your Zoom toolbar, which might be at the bottom or the top of your screen, if you go to the chat icon, there's a little arrow that you can click, and within that you can unclick show chat previews, so you won't see all the little pop-ups. And if you need assistance with that, you can just private message Carrie or Junie, and they can help you out with that. Next slide. I just wanted to start with a land acknowledgement before I go through our next few slides. Acknowledging that in these types of environments on Zoom, that we're all coming from all different areas. I'm actually coming from you today in Hamilton, Ontario. But our team, who is situated within the Institute for Better Health at Chilliam Health Partners in Mississauga, we would just like to acknowledge that the land on which THP operates is the treaty lands and territory of the Mississaugas of the Credit First Nation. It is also the traditional territory of the Huron-Wendat and Haudenosaunee. The land and the lakes in the region continue to be home to many First Nations, Inuit, and Métis communities from across Turtle Island, which is currently known as North America. Next slide, please. And as I mentioned, today's recording will get posted on our YouTube library. So if you haven't had a chance to attend our past sessions, you'll find all 4 of them there, in addition with a pre-module that is included as part of the series. And what's really nice about all of these past sessions, if you haven't had a chance to check them out, or if you just want to review them, is that they really lead up nicely to today's session. So we've had one on communication, compassion, and empathy, bearing witness to lived experience, equity, diversity, and inclusion, and leading into challenges that sometimes you come across as you're trying to participate in engagement. And you'll see some of that content come out in today. So you'll see some topics related to tokenism, talking about relationship building, even revisiting empathy communication model that was first presented in our first session. So we'll start to see how the pieces kind of connect together in the content we have for you today. And with each session, there is a workbook that you don't need to use necessarily during the session, but each workbook follows some of the content of the session, provides you with tools and tips and resources that you can use to reflect with yourself or to take that back with your team. So as usual, we do have a session workbook today that you should have seen in the registration reminder email. If you didn't receive this workbook, or if you'd like to receive past workbooks, you can email me or Junie, and I'll get Junie to put our emails in the chat, and we can send those to you, no problem. Next slide. All right, so we're going to get started in just a minute, but just a quick outline. So today is focused on preparing for your engagement. So as I mentioned, we're going to focus a lot on the recruitment, the onboarding, and the preparation pieces of it. We are hoping to have some time to open up the floor for question and answer. So if you can save some of your questions until later on and put those in the chat, or you're welcome to come off mic as well at that time, and we'll try to get through as many as we can. And as I mentioned, if you can stick towards the end, we would really love to get your feedback on what kind of activities we can try out in the next session as part of the engagement methods. Next slide. And I do want to just give some quick acknowledgements to our members of our working group who have spent a lot of time and effort in creating today's session and the workbook that accompanies it. So we all come, we come from different places, from the Institute for Better Health, Children Health Partners, the Sport Houses Center for Innovation and Peer Support, and the Ontario Caregiver Organization. And so here I just want to acknowledge our working group. If you are just logging in, I'm Michelle Marcineau, the research lead of the Patient Experience Research Team on Dr. Carrie Kolesky's portfolio. I'm your facilitator for today. We have Alyssa and Ethan, who you might actually recognize because they actually ran our very first session. So we are so excited that they were able to participate, again, in this session and developing the content. We're so thankful for all the knowledge and resources that they provided. Unfortunately, Ethan can't join us today, so we are going to have Alyssa, but I do want to introduce them both. They're from the Support Houses Center for Innovation and Peer Support. It both identifies people with their own lived experience and as caregivers of others navigating their own experiences. At the Center for Innovation and Peer Support, they both support organizations in implementing, integrating, and sustaining values-based peer support and meaningful engagement in co-design practices with people engaging in services. And they do this through capacity building, consultation, communities of practice, and curating of resources, webinars, and trainings. And I also would like to acknowledge Bianca and Reham and Carrie, who of course have also contributed their time, their knowledge, and their resources. And they are also welcome to jump in later when we get into the Q&A session if they would like to join that as well. So with that, I'm actually going to pass it off to Alyssa for the rest of today's session.
Wonderful. Thank you so much, Michelle, and thank you all so much for being here today. As mentioned, my name is Alyssa Gremin, and I will be walking us through this session. It is going to be a more content-heavy session. There will be some small engagements throughout, and we're hoping for that Q&A session at the end. So jot down any questions you have as we go through, as well as, or in addition to that, because it is content heavy, I encourage you to sit back, relax, enjoy a cup of coffee, and just take it all in today as we go through. So we're going to start off revisiting co-design, and throughout this session, as mentioned, we will be building on previous learning and see how the previous modules all come together for the planning and preparation of co-design activities and processes. So we're going to start off with a bit of engagement here. What does co-design mean to you? And so what I'm going to ask is, if you're comfortable, you visit www.menti.com and type in the code on the slide. And then from there, Junie will share our responses in live time. And we can just explore, based on this learning series and maybe other knowledge you have, what does co-design mean to you? And so we'll keep the slide up for a little bit longer, just so you can type in the code. And I see we have feedback from users, partnerships, collaboration a few times. Working with a diverse team to create something, co-creation, there's that creation again. Listening to all voices, bringing lived experience, having shared vision and shared responsibility. And Junie, I don't know if you want to scroll down a little bit, if that's possible. So actively seeking feedback, that action associated with it, meaningful participation together, doing things differently. I really like that, because that's really the crux. Why do we come together? To do things differently, to solve some problems. So it really gets to the crux of it. It also speaks to some of the shifts that co-design may require for us. Collaborative healthcare, nothing about us without us, and shared power. Wonderful, yes. So a lot about listening, coming together, partnerships. Beautiful. So we'll give it a couple more seconds and then maybe I see folks are still adding in. An environment of safe space and equitable collaboration. Wonderful. So talking about that equity and making sure that everybody can come together in that shared power, and making sure that that space is shared, is truly shared among the folks around the table or in the room or in the space. And I see creativity has made it in, collaboration and creative dialogue. Absolutely. Wonderful. Different mindsets to creating comes forward. All right, so I'm going to bring us back to the slides, and we'll look at some formal definitions, and you'll see in the formal definitions that, oh, I see we have a chat message that I'll quickly shout out. Non-judgmental listening and working to a real vision with change. Love that. And so we'll look at some formal definitions of experience-based co-design, and you'll see that they touch upon many of the elements that we saw in our Mentimeter. So we talk a lot about coming together in partnership, and that definitely comes through in both of these definitions. So according to Mulvale et al., in experience-based co-design, patients, family, and caregivers work collaboratively with designers and staff to improve service systems by translating the experiences of these groups into tangible service redesign, so that creating something different coming through here. And then we have co-design is a process used to create products, services, and programs. It brings people in as design partners, giving a voice to those who are often excluded. So we see in both these definitions the highlight for the need for working in partnership and meaningful collaboration, and we're going to explore that throughout this session. And so I'm glad to see that we are all on the same page with what co-design means. When we review various engagement methods, we can see how different methods support different processes and at various degrees in the engagement pyramid, if you will. And this is something we created for this presentation. But as we move from informing to partnering, these build on one another. So as we increase the degree of engagement, we also increase the investment that we have to place into our engagement processes, the influence that these engagement processes will have, and the involvement of the voices who are informing the work. And so the degree of your engagement will direct who you reach out to and how you engage in recruitment. Engagement methods such as surveys or interviews on their own do not require maybe putting together a team of staff and experience-based partners necessarily. They can, but they don't necessarily warrant that. And these methods are primarily used to inform other processes. So to get a general sense of what's going on. In the middle, we see activities such as structured interviews, meetings, and group discussions, which require a bit more investment and help us to understand more context related to our work. Co-creation methods such as experience-based co-design activities, committees, and task forces, and patient and caregiver advisory councils require the highest level of investment and do usually require project teams. We will discuss this more throughout this presentation and kind of what those teams do and how we can work together. A project team can utilize any of the engagement methods. So you can use surveys or co-design in your co-design project work, but this graphic highlights that items like surveys and focus groups are not in themselves necessarily co-design processes. So they can definitely be part of engagement, but they're not necessarily co-design. So tokenism, we talked about this briefly in the pre-module. Tokenism is defined as the policy or practice of making only a symbolic effort. So this is when we invite people for the sake of inviting them, especially diverse identities. It's when we invite people, but we don't give them a very clear purpose or enough influence or very much decision-making power. And so they stay kind of on the fringe, or they're consulted in small ways. And that's not partnership. And so what we're talking about today is, how do we build this partnership? How do we prepare for partnership? Inviting people to the table is not enough for true co-design. They need to have that dedicated purpose, that influence and power decision-making power, sorry. And it requires a true investment in that relationship building. Your goal in partnering and co-design is to come together as equal voices in the pursuit of a shared goal. And so people who are affected by the problem and those in a position to do something about the problem should come together in co-design activities and processes. Co-design is the actual process, the actual activities that we're doing together. And it includes everyone's expertise. So leaders and workers and staff, patients, family and caregivers, and perhaps others like consultants or folks with specific expertise. And this gives us a 360-degree view of issues, but also potential solutions. It also involves sharing power. So not swaying too heavy one way or the other. We've seen co-design processes that lean heavy into professional expertise or lean really heavy into living expertise. And this is about balancing and sharing that power, not about giving all of it to one or the other, because we need to make sure that we're not harming anyone in the space or the process is moving forward. So everyone's expertise and power needs to be considered. And when we embrace this, we're embracing a culture shift. So this is the result of building relationships. Shared power then becomes the foundation for genuine partnership and trust. And we're going to talk about that in a little bit. Finally, and I will say this over and over again today, it is about relationship building and inclusion. The emphasis on relationships and connections becomes the driver for innovative change. So we know that when we come together as equals and we invest in these relationships, we can have the innovative change that we're looking to have by partnering. So we're going to spend a little bit of time talking about how to build relationships, and we're going to build these relationships right from the beginning, and this is how we avoid that tokenism. So according to Catherine Milligan and colleagues, and this is a quote we saw in the pre-module, but I thought was really relevant to today, relationships are the essence of fabric of collective impact. What's critical for those who facilitate collective impact efforts is to support relationship development in ways that builds true empathy and compassion so that authentic connections happen, particularly between diverse participants. These deeper connections can form new avenues for innovation to address the social problem at hand. And throughout the previous modules, we've explored elements of relationship building, but this process is, again, really important right from the beginning. So we're going to go into a second Mentimeter and talk about how we can build authentic connection. What comes to mind when you think about building relationships with a team, with a group of people? What comes to mind right away for you in something that maybe needs to happen in that space? And so I'll let Junie share the Mentimeter. And again, the code is at the top. Oh, we have lots of folks. Invest in getting to know each other and the team early and often. Yes, and that can be small things. Sometimes when we come together in formal ways, we forget the humanity within the space. And so let's invest in the small conversations and in really getting to know each other. Maybe it's a check-in at the beginning or something like that. Start with everyone's why. Yes, why are we here? Why did we come together? Quality communication, honesty, engaging in truth telling. Sometimes that can be really difficult, but when we come with the truth and that transparency, it builds that trust. Meet for coffee, listening and learning, having common goals, real life stories, yes, from everyone in the space. Space for sharing and listening and believing in each other. Building trust and comfort levels with all involved. Encouraging folks to see that they can own their truth and expertise. That's a really big one, because there have been lots of spaces I've been a part of where I come with that living expertise or my truth, but they're not always safe and comfortable spaces. And so how do we create space where that truth and expertise can come forward in a meaningful way to support the work being done, but also where it's not dismissed or invalidated? Walk the talk, actions reflect priorities. This is very true. So sometimes we say with all good intentions that we want to engage and trust each other, but we don't spend time doing that work. Courage to have crucial conversations. It's so important to acknowledge that courage belongs in these spaces and that we need to create space for people to be courageous. And that requires vulnerability. I've seen someone put vulnerability in the space as well. So creating space for vulnerability allows people to be courageous, but we need to also be supportive when that shows up in our spaces, and that'll help us create bonds. Wonderful. Give it a couple more seconds. Transparency, absolutely. Believe in intersectionality and the value of a common vision. These are some great tangible strategies to acknowledge in our spaces. And so they can be really important words, but consider for yourselves, how are you going to take these words and move them into your spaces? How do we create that? And we have some tips throughout this presentation. All right, so I'm going to move us back to the slides. And we're going to touch on two important elements next, both being, and they will be empathy and trust. And so this is a bit of a throwback to module 1, but we looked at some work by Brene Brown, who cites Teresa Wiseman, who is a nursing scholar. And Teresa Wiseman looked at diverse professions where empathy may be relevant. And she concluded that empathy is made up of 4 qualities, and that's perspective taking, staying out of judgment, recognizing emotion that shows up in the space, and communicating it back. So this often looks like in our practice or in our spaces as genuinely listening, remaining open and challenging our biases, understanding people's context and the context in which they're sharing, and communicating back our understanding of that. And so we need to create space for empathy. And in module 1, we explored the empathetic communication model. In module 2, we explored strategies for bearing witness and lived and living experiences. So if you're interested, I encourage you, and you missed these, please check out the YouTube library that was mentioned at the beginning, and you can learn more about these. But these can be really useful tools to bring to our space to ensure that we're communicating and building those relationships that are based in empathy and compassion, as we heard from Catherine Milligan. I really also enjoyed this quote. I thought it was really, really crucial. And it speaks to the vulnerability that came up in the chat, in the Mentimeter. Sharing power and building meaningful relationships involves taking risks and building trust. And according to Bovaird, service users and professionals must develop mutual relationships in which both parties take risks. The service user has to trust professional advice and support, and the professional has to be prepared to trust the decisions and behaviors of service users and the communities in which they live, rather than dictate them. So when we talk about sharing power, this is it. It's about taking risks, and it's about putting our trust in each other, no matter who we are. And I think that that's a really important element to our work together and to partnering. So if you wanted a model or something quick to look at building trust, we're going to cite Brene Brown again, and she has an acronym called BRAVING. And I think that all of these elements are so important. And she starts with boundaries. Setting boundaries is making clear what's okay and what's not okay, but also sharing the why. This really creates safety and comfort in your space. And I think that that's a key element here. Boundaries are not bad things, and they don't always need to be asserted. They need to be shared. We just need to share what are our boundaries. We need to create our boundaries. And this should be done as much as possible collectively within our spaces. Reliability is you do what you say and you say what you do, right? And so we want to show up for each other in those ways so that we're not creating harm or resentment. Accountability, we own our mistakes, we apologize, and we make amends. It's going to happen, and it's okay. It's okay for it to happen. It's okay for things to get tense. It's okay for things to be tricky, but let's acknowledge this. Let's own our mistake. Let's apologize and make amends when we can. And it really just shows humanity and builds that trust factor for people. Another thing that builds trust is privacy and confidentiality. So she dubs this as the vault. So not sharing information or experiences that are not ours to share. When we don't share others' experiences, people trust that when if I tell you my experience, you're going to keep that in your vault and you're not going to go and tell others. So a really important facet there. Choosing courage over comfort, choosing what's right over fun, what's fun, fast, or easy, and practicing your values, not just professing them. This can be hard. This can be really, really hard. Sometimes we see a lot of barriers, and it takes a lot of courage to break those barriers down and to start challenging the way that things have been for a long time. And courage is going to be a really big thing that we need to embrace, and that's everyone around the table. Non-judgment, so creating a space where we ask for what we need and from all angles, and talking about how we feel in the space. How are we feeling about what's being discussed? How are we feeling about our next steps? Those can be really key questions. And generosity, this is my favorite. Extending the most generous interpretation to the intentions, words, and actions of others. I summarize this as holding others in unconditional high regard. So how do we generously hold people in high regard and recognize that their intentions are not to attack or belittle or demean people? Generally, it is to point out maybe blind spots or alternatives and things along those lines. So I'm going to ask that you just take a moment. I'll give about 30 seconds to reflect on which one of these might be most important to you right now in your journey of building trust with folks. What would be really important, and how can you demonstrate that to folks that you may be engaging with in co-design? So we'll just take a quick moment for that. I see some folks are jumping in the chat. If you would like, you can do that as well. It is hard to pick one. They are all important. They all make up trust. So there's not one that's more important than the other. But what's speaking to you as something you can do for yourself? And I really appreciate that different ones are coming up for different folks. So something to be mindful of in your spaces is that what you think might be the most important element to building trust and where you might invest your energy might be different than someone else in your space. Reliability, accountability, wonderful. We'll give it another couple seconds and then we'll move forward. Fantastic. Thank you all so much for considering this. And if you're curious, Brene has a worksheet with this on her website. So you can always Google that and check it out and keep it close by if that feels good to you. So that's setting the foundation, right? We need to understand co-design. We need to understand relationship building because that's what co-design is. We're at that bottom tier in the pyramid. And now we're going to get into some of the planning. And so when it comes to planning, you're going to have usually a smaller team that kind of starts conceptualizing the project, starts the process of recruitment and onboarding, and maybe leads some of that. And then you'll have a bigger team that carries out the work potentially. So this is just one way of doing it. And if you have these elements in place, then these will be relevant. But there are different ways that you can approach it. And we just wanted to cover the full breadth so you could have these considerations on hand. So your first thing that you're going to do is perhaps start a steering committee or group or a planning group of some sort. And this group is going to organize the foundation of the project and initiate additional recruitment processes. It will grow and it can become part of your actual implementation and co-design team. Or you might see some people step out at that point. The steering or planning group may include a leader, and I think that this is crucial. You need to have someone who can do something about the problem, right? Who has some of that power in their role to do something about the social piece that we're talking about. And oftentimes, not always, that is an organization leader. So it's important to have buy-in, right, from all layers of our organization. We also want to have a project facilitator, ideally with some level of engagement expertise, but not necessarily, it's not necessary, but it will be helpful because you will be facilitating the space and the project. This is a crucial role and you're responsible for setting the timeline and making sure everything runs on time, and you might be a dedicated worker on the project, or this project might form just one element of your day job. Either way, the facilitator needs dedicated time to manage the process. If your OHT has an engagement lead or an engagement facilitator or someone dedicated to engagement in general, it may be helpful to include them in their expertise. You will also want to include data and evaluation or quality improvement and project management expertise in your project. This can really help you work through some key elements as you examine problems and come together to solve them. If your organization has an existing patient, family, and caregiver advisors anywhere in your organization, then perhaps having them in the steering committee can be really beneficial. It's great to have them there right from the start, and they're going to help you identify some barriers to participation or other considerations as you go through recruitment and onboarding processes. If not, and you don't have existing engagement in place with people with lived and living experiences and family and caregivers, maybe it's time to do some surveying, some focus groups to learn about the barriers and the remuneration and any supports for inclusion that may be of benefit to this project. So just something to consider there is you want to be exploring this right from the beginning, because sometimes we spend time putting a plan together and then we hit some barriers later when it comes to recruitment. So at the beginning, we're going to look at the project goals, the scope of the work, and what we're hoping to learn. Why are we coming together? And what is the project timeline? When are deliverables due for this work? This is going to often shift. As people actually come together to do the work, you will notice things usually take longer. So I highly recommend giving yourself generous timelines when you can. And you will also want to build in time for onboarding and coming together and building relationships within this process. So make sure that that's embedded within your timing and scope of time. You also want to consider capacity and resources. So what does the anticipated work plan include? So this is where you're drawing up a rough work plan. It's a tentative one. You will finalize it with your actual working group. We want to consider if there's enough staff capacity to make this project a workload priority, or consider how much time and capacity people have. We also want to explore and understand the capacity and time commitments that we'll be asking of experience-based partners, and maybe some of the administrative tasks. Oftentimes we forget that it's more than just a meeting. There's all the administrative and in-between work that happens on these projects. And so we need to be mindful of that. And then we want to look at resources, and this is time, space, money, efforts, and technology, and if there's any possibility for remuneration for external partners. So think about how you would pay a consultant or field experts or your experience-based partners. And we want to make sure that any remuneration is equitable as you're requesting the expertise of each of these partners. You want to consider how you'll come together. Is it in person? Is it virtual? Is it a hybrid model? And this is going to really impact how you recruit and make sure that you include this in your recruitment process. So we need to have that already solidified and understood in the beginning stages of this project. Then we want to consider access and equity in engaging in the space. So what are the unique challenges and barriers do different folks face? And we say patients and caregivers and focus on that, but it's also going to take into consideration your staff and what is the flexibility there. So meeting times, consider when people may be working or going to school or have other activities. If you're, for example, working with folks who use drugs, there may be better times of day for folks that are using different substances. We want to consider the impact of medication. For some people, it's better early in the morning, for others later in the day. Transportation. If we're meeting in person, you may need to reimburse transportation costs or provide parking passes or provide public transit tickets, and what is the possibility around that? We want access to technology to be considered. So if you're meeting virtually, do people have access to technology, and is there a way to support that process for different equity deserving groups? Accessibility, accessible spaces. So is it physically accessible? And can you provide spoken or sign language interpretation if that is relevant to your space? And you're hoping to engage with folks that maybe need those services, or if you were to have someone who needs those services apply. Then we can look at who are we engaging, right? This is going to include relevant staff, people with relevant lived and living experiences. Different projects are going to engage different people. So it really depends on your scope. It really depends on your timelines. And so it's okay to consider those elements. And I also want to highlight that while the roles of experience-based partners are similar, there is a difference between patients or people with their own firsthand personal experiences and caregivers and family members. And so sometimes we see groups say that we've engaged lived experience and they've only engaged family members. And so we recognize that there are two kind of different entities at play here. And that's why we always talk about both of them. And sometimes their perspectives align and sometimes they don't. And so we need to create space for all of those perspectives to be present. And I see there's some appreciation in the chat, so thank you so much. Then we want to look at methods of engagement. So we need to look at which methods are most likely to help you achieve your goal, which are most conducive to the project timeline, which best align with the capacity of staff and patient caregivers for your initiative, which do you have the resources to support. So focus groups may be part of your process with your co-design team. Your co-design team may go do some additional focus groups, and that's fantastic. Do you have the resources for 5 or for 10? And who are you engaging in each focus group? Will you which methods will best address the challenges and barriers of staff and patient partners, allowing for fair and balanced participation? So how do we build capacity and understand that? And which are most suitable for those who are engaging? For some folks, surveys are best, depending on the populations, communities, or groups that you're supporting or engaging with. And for some, it's going to be focus groups or meetings or both. So really just taking into account all of these things, and that's going to help you build your timeline. So this isn't a linear process. This is all a big discussion point in terms of planning, but these are the things that we might need to consider in terms of conceptualizing our projects. So up until this point, we have shared the foundational processes of any engagement-based activity, and now we're going to take a further dive into the follow-up processes for partnering and co-creation. So this is more looking at how do we support co-design activities, task forces, and committees to do their work. And you're going to start with recruitment. So with a steering group created and the foundation of the project established, it's time to recruit. And you're going to recruit staff, patients, and family and caregiver partners, potentially other expertise as well. And so partnership and co-creation is not simply the gathering of many perspectives, but rather gathering people with diverse perspectives who also have the skill sets to support quality improvement processes and work with people of other diverse perspectives. And so it's not just about inviting a bunch of people to the table and hoping it goes well, but looking for people who have the skills necessary. And I'm going to tell you that that can be absolutely anyone experiencing anything from any walk of life, but just because you have lived experience does not mean that you will be good at this work. And I think that that's important. And just because you're a staff that works for an organization doing this work doesn't mean you're going to be great at coming together in a co-design space. And so we need to look for kind of our champions of this work. We're looking for passion and ability to work with others and knowledge of the issues as well as the barriers, and people who are solution oriented. When we're creating positions for lived experiences in patient and family and caregivers in the initiative, there is no metric or gold standard of how many people with lived experience need to be included. This is largely going to be based on what experiences and skills and knowledge is needed to benefit the project and its goals and its timelines. However, more than one voice is always better, and having multiple but diverse perspectives will enrich the initiative. And I've seen some co-creation work where the majority of folks have lived and living experiences of either being a family member or their own experiences. And then we have a few key staff members and change makers in the space, and that can work beautifully. I've seen it the other way, where there's a few key stakeholders from the community and some other folks that work for organizations. And it's all about how we share power in the space. And if you have a smaller group, it's good to include other engagement processes, such as surveying and focus groups, just so you get more than the 3 people you have at the table's perspective. But those 3 people will help you shape those processes. All right, so I want to quickly highlight the relationship to experience spectrum, and this is something we created at the Center for Innovation and Peer Support to recognize that we all have relationships with our experiences, and whether that's an experience as a staff member or as a person engaging or interacting with service systems. Our experiences make up a large amount of our expertise, and when we are connected to our experiences, so right in that middle, that's going to be our sweet spot. This expertise can lead to cohesive, collaborative relationships with others to create positive change. When we move to either side of this spectrum, when we're consumed or removed, we are usually unable to effectively work with others, and this impedes partnership and creation of change. When recruiting for partnership and co-creation work, it is important to recruit people who are connected to their experiences rather than consumed or removed. And you can usually get a sense of this pretty quickly through the application process if you have one. Another key piece is this is not a measurement of time. Sometimes people require time outside of treatment, time beyond treatment, time into wellness or recovery. And that's not always going to be helpful. What you're looking at is how are people connected to their journey instead. Because some people will have a longer term and be removed, and some people will remove themselves from their experiences right away. And vice versa when it comes to being consumed. So when we're looking at consumed, folks are often going to overshare from their personal or professional experiences rather than intentionally share parts of their journey that are of support. They're going to dismiss experiences of others in order to support their own beliefs. They may shame or blame others, and they may, or professions that they've interacted with. They may be unwilling or unable to professionally and assertively and respectfully collaborate with others, and they can become easily upset when others share. And so that's something to look out for. When folks are removed from their experiences, going all the way to the right, they may undershare, and they may not actually be able to meaningfully contribute from their personal or professional experiences. They may dismiss the value of others' experiences and the insight it brings, and they're going to ultimately uphold the status quo of services and systems rather than pursuing that meaningful change. They are going to be less likely to empathize with others' experiences. And now we'll move into that sweet spot. When people are connected to their experiences, they intentionally share parts of their personal or professional experiences in a way that meaningfully contributes to conversation. They value the experiences of others in support of the shared goal. They hold others in high regard. They're able to collaborate with services and systems and communities and teams in a way that is respectful, and they support themselves through difficult conversations. So they're able to navigate these spaces a little better. And this can take some skill building. So, and different people are going to come at this, and it's a spectrum. So at different times we might move to different places depending on what's talked about. So it's not an absolute, but it's something to just bring some mindfulness to. When it comes to promoting these roles, and we've narrowed it to experience-based partner roles, but I'm going to say any roles, we want to seek diverse applicants. And so we want to reach out to absolutely anyone that we can look at who may have a stake in this problem. And so we're going to look at things like age and sex and gender and identity and orientation, sexual orientation, income, education, maybe different neighborhoods or other areas of identity. And we're going to be proactive in this. So let's ask community organizations, businesses and residents or associations and social service agencies to help us find folks. So there's lots of opportunity to reach out and build relationships, not just with people we're hoping to engage, but with organizations and places that they attend or are. And let's build that up. We want to stay visible inside and out. So if you have any social media or website places where you're posting this, I encourage that. Use clear language and design to reach the widest audience. Make sure that we're using accessible language and plain language and that the design is inviting. And you want to clearly, this is probably the most important piece, clearly articulate the role, including a description with the desired skills and the experiences you're looking for with remuneration. So really looking at what are the lived and living experiences that are going to be beneficial and what is the knowledge and skills that will be beneficial to this project and this work. And that needs to be stated very clearly. We talk about being really transparent and understanding the expectations of the space. All right. So now we've done some recruitment. We've put it out there. Hopefully we've found some people. If you do, and this is not part of the presentation, but if you do have any type of interview process, I highly recommend including a patient or family and caregiver on the hiring panel. It can be really, really beneficial to your process. So if that's available to you, please include that. But your team might start to look like this. So when you finish recruitment, your project team may look like this, and a team made up of your initial steering group as well as relevant staff, patient partners, and caregiver partners. We have the engagement facilitator kind of outlined because we recognize that an engagement facilitator or leads that exist within OHTs may be useful, but if that doesn't exist in your OHT, this can be any member of the team. But it's also to signal that all members need to be dedicated to engaging with one another. So this doesn't rest on one person. It would just be really neat to have someone who has experience in different ways of engagement and different processes at your table to help facilitate some of your conversation. So it's not that they're less valuable, it's just to say that that can move around. And in fact, they're integral. Let's look at capacity building. So this is the onboarding portion. Before and during activities, so this can happen before we get together or throughout our project, it's important to consider what are the needs of our team and organization. And in the pre-module, we briefly explored a slide that looked like this from Baker and colleagues. And so we're going to break it down and dive a little deeper into each of these layers and look at what people need at each of these places. So when we're looking at organizational leadership and strategic focus, we need to know that there is buy-in at the leadership level for part of this engagement work. And so is it part of our strategic plan might be a question we're asking. Are we including patient, family, and caregiver partners on decision-making tables and hiring committees? And I'm going to say our direct service staff as well, right? So that we're hearing all layers and elements of our organization. Does leadership value the engagement of patient, family, and partner and caregiver partners? How will we ensure capacity for this work? And is there a willingness to incorporate the feedback and recommendations that come from co-design activities? This is really crucial. You can do all this work and it ends up on a shelf. And that is so sad to see. And it happens sometimes because of timing or other things. And I understand that. But if that is consistent, then there's a larger conversation that needs to be had as an organization as to what our hesitancy is and our willingness is to incorporate this feedback and recommendations. And so there's nothing more frustrating. And so if you are a leader within your organization, how are you going to ensure that this work moves forward and is valued? All right, for staff, do our staff know how to engage in an inclusive manner? Do they know why this work is important, why co-design is important? Is this an add-on off the side of their desk, or is this embedded into their day-to-day work? And are experienced engagement-oriented staff paired with staff that are new to engagement? So this is where you can have that diversity within your staffing present, so that we're learning and there's a continuation of this work beyond one project, and we're building the capacity of our organization as a whole. So the resource at the bottom here is in your workbook, and I think is a really fabulous checklist that we can use for staff that may be part of this. And I think it could be adapted for others as well, but it can also be adapted as a pre and post survey to see if any capacity building you've done or learning around OHTs or around engagement. Sorry, I went to the OHT Learning Engagement series, but around engagement in general has increased people's comfort with this work. And then we have patient, family, and caregivers. And we need to acknowledge that they may need some capacity building as well. And we need to look at what are the expectations that are set and reviewed between staff and patient and family caregiver partners. Our patient, family, and caregiver partners ask what they need to feel prepared for meetings and activities. Are there barriers? And do we understand these barriers? And our experienced patient and family caregiver partners may be paired with new partners. So if this is an ongoing committee or task force, as you onboard new patients and families and caregivers or new folks with lived experience, how are we going to pair them up with ones that have been there for a while and keep that continuity going? All right, and this is something that we want to acknowledge for all is a collective knowledge base for everyone here. So we want to take stock of any subject areas that your team will benefit from. And so I'll let you read the slide, but one thing I want to highlight is quality improvement. And I'm going to give a shout out here. I took a training not too long ago through Excellence Through Quality Improvement projects, and my experience with that was fabulous. And I think that it's a really beneficial course. So if you're interested, you can check out EQIP and their course on quality improvement and how to do some key quality improvement activities, really great tangible strategies that you can use in co-design work. All right, so we've done all this. Let's come together as a group and talk about how we create a collective culture. I'm not sure, I can't remember the name, and I should have prepared that. I see a question, but if you visit EQIP's website, they'll have it listed there. So if you're curious, I'll put it in the chat. I put it to one person. Here we go. I'll put it in the chat and you can check it out. Just Google EQIP. All right. So general considerations, we want to talk about confidentiality of our space when we come together, including the confidentiality of each other. And if you have people who are engaging in services at your table, making sure that the staff at the table aren't checking their records is a really key piece of this. It's rare, but it could happen. And so what are our safety measures in place for that? And also the confidentiality of the project. So what can be shared when and with who, and making sure that we're not sharing what is shared, the experiences shared in the space outside of our space. We want to discuss boundaries and dual relationships. We want to create equitable participation pathways. So really talking about how are we communicating and making sure people are supported in that process. And this is really, really important. Remain flexible and adaptable. As you unpack the work, be open to potential pivots and changes. So as we're doing this work and moving through this, we need to be really ready for some of those shifts to come up. So your initial work plan that you've gone through and talked about, which is coming up, might shift over time. So we heard about a collective purpose in our Mentimeters, and this is really important. So we're going to share the scope of the goals. We're going to also get to know each other. Why are we coming together? What brings everyone to this work? Exploring this will help people find commonalities and to express their motivations and involvement. And what expertise is part of this project? So I've seen an activity where people create a collective resume. And what they'll do is they'll ask everybody what skills, what knowledge, what activities they've been a part of, and then they put it all together into one document and look at all of the knowledge and skills and expertise at the table. So you might have over 100 years worth of experience among people at the table in a specific area of knowledge. You may have folks that have done really unique things that they get shared. And so that can be a really cool activity to engage in and get to know each other with. You also want to talk about your communication pathways, who is responsible for communications and coordinating project goals with all members. So that might be your facilitator, it might be an admin person on your team, who's taking minutes, who's doing this work, what are minutes, even talking about that, and also when a response is expected back. So if something's sent out, how quickly do we need to talk about that? So when it comes to creating a collective culture and accountability, I'm going to fly through this because I do want to give some space if we can for questions. It's important to acknowledge brave and safe spaces. And some people feel that a brave space is where we want to move to and that safe space has been around for a long time. I feel you can have both. You can have a brave and safe space. I think that both are incredibly important to coming together. It's how we build trust and allow for us to take risks in our space. And so we want to look at what are the collective expectations of the project, of the project members' conduct, and how will members create a space of safety, how will decisions be made, and how will disagreement be resolved. Creating guidelines through a terms of reference or other documents, it could be our group values, our group guidelines, anything like that, really helps us to keep each other accountable and maintain the courage and safety within our spaces. There's also a template for module 2 that you can use, but we'll walk through a couple examples. So in these guidelines, you want to talk about meeting attendance and expectation around response times and respecting timing of meetings. I'm going to say that when we put structures in place, let's put structure in, but we don't need to be super rigid. If somebody is 5 to 10 minutes late, let's acknowledge that something may have occurred, whether it was related to caregiving or whether it was related to their own experiences or whether a meeting ran late for a staff member. Let's just be glad that they came into the space. So let's create some flexibility, but really acknowledge that there is a structure. And the next is our guiding values. And so it can be really helpful to list out what your guiding values are. And this is an example from the Minister's Patient and Family Advisory Council. And they have the values of respect, collaboration, inclusiveness, and innovation that guide their space. Finally, there's also guidelines around how we work together, and let's outline those. And these are some examples that you can maybe incorporate in your work together. You don't have to, but if you're interested, you absolutely can. So coming together in unconditional high regard and treating each other with respect, kindness, and empathy. We want to be open to new ideas and create space for multiple truths. Sometimes there isn't going to be a resolution. There are going to just be multiple truths, and recognizing that is okay. We want to be curious and have a willingness to have our minds changed. We want to share from our experiences and learn, and this means that diverse viewpoints are welcome and that we understand that innovation often happens at the intersection of different perspectives. So we're going to foster an environment where members have the freedom to express themselves openly and raise concerns or objections respectfully. We're going to listen deeply. We're going to focus on possibility and see obstacles as opportunities for learning. We're going to embody the values of diversity and inclusion and uphold a space free from stigma, prejudice, and discrimination. We're going to be willing to fail and learn from it, and I love that one. That comes from the Minister's Patient Family Advisory Council. And we are comfortable navigating uncertainty and exercising patience in implementing system level change. Another one that sets the tone and the pace of what we can expect. So any of those that stick out to you, feel free to use them. They are cited on the slides, so you can find the original sources. You also want to come together in the beginning of your stages or throughout your project and revisit your collective approach. So what are your timelines? What are your timeframes? You might have done some of this pre-planning work, but we need to share that with everyone who's now involved. We want to identify who will be involved in which parts and what is the meeting structure and frequency. Be mindful again, timelines and milestones may change and flex, so we need to revisit this throughout. And that's the collective approach. And our final slide here is on evaluation. From the beginning, throughout your project, as you come together, it can be really helpful to have evaluation baked in. And so I'm part of a group, and after every session, they send a survey, just a very brief one, where you acknowledge how strongly you agree with the following questions. So did we talk about what we meant to talk about? Were you comfortable in the space? Did people have the space to speak? And were contributions valued in the space? So simple questions like that. Let's get a touch point of how we're doing as a group and revisit that together. And that can be really key information for the project facilitator. And then you want to explore how you will evaluate if the innovations of your project team are going to be effective at achieving your intended goals and outcomes. So throughout the project, we want to have this baked in. And we're going to also talk about how do we know that what we're saying and doing is working, or once we get to the implementation phase, how are we going to measure that and the differences? So really good conversation to have, and that's where things like the equip training can come into really helpful, or having that person with the data and evaluation experience as part of your project team may be really useful. And so that wraps up all of the considerations that we've come forward with for today's presentation. I know it was quite a bit, but I'm grateful that this is being recorded. And so you have this as a record for yourself, and you can walk through as you need and look at the different components. So we'll move into Q&A. And what I'm going to ask is if you have any questions, and we'll probably do this for about 15 minutes. So it's going to be a short Q&A. I'm going to ask that you use the chat as much as possible, but if the chat is inaccessible, feel free to raise your hand or come off your microphone and ask a question. And I see we have a question about sharing the evaluation questions with the group. And so I will do my best to, I'll make a note of that, and I'll send it to Michelle and Carrie, and they can maybe send out an email if possible. Carrie and Michelle, I just signed you up for more work. I hope that's okay.
Yeah, we can include it in our follow-up email that goes out post-session, no problem.
Wonderful. All right, so Carrie's jumped in the chat with another key part of co-design is looping back with the co-design activities done. Does anyone have strategies of what this can loop like? That's a great question. And so I'll let folks answer that in the chat, and I'll speak to maybe some of those key pieces. I think that is really important to acknowledge is that we close the loop. So if you're doing a co-design activity that's maybe a one-day design day, and you're not doing an ongoing project, let's say, you need a way of communicating back. And so I've seen people put out reports, magazines, really cool email blasts, things like that talk about the successes. I've seen folks reconvene to review data and evaluation and come together to talk about what's been accomplished. And that one is personally my favorite. So I think that can be really helpful to do, but I'm sure a closeout meeting, somebody's put that in the chat, absolutely. And I saw that someone earlier put that we do have an upcoming session all on evaluation. So stay tuned for that as well. I did forget that. So I believe that's one of our final sessions in this learning series. Are there any other questions or? Oh, I see a really important comment. It's important that patient partners play a role in the report development as well as to hear it. This is so important. This is so important. So I consider that as still part of the ongoing project work, but you're absolutely right. in terms of writing different elements of that report, in terms of reviewing and providing feedback on that report, can be really, really crucial around languaging and understanding. It also helps build capacity and understanding of how these processes work. So I think that that is a really valuable contribution. Thank you so much, Kathy. That is a really crucial piece. And sometimes we forget that experience-based partners can be part of these formal processes. And it does require a bit of investment. It may hold up your timelines, but it's really, really valuable in showing how important people are. I see a question from Nancy. So my question relates to setting boundaries for work, especially with Indigenous participants. This may be sensitive, and wondering if you have any experience suggestions to approach this with this population. I don't. I'm going to be very transparent, but I think that every community has their own ways of engaging. And I really think that exploring with them what is going to make the space comfortable, what is going to make the space engaging, what is going to make you feel safe and comfortable to share from your experiences is a question. And especially if you're providing remuneration or they're actively engaged in the process, it's not asking people to educate you necessarily, but because they're already part of this process and they're being valued in that work, it can be okay to ask those questions and really explore with people what that looks like. And I'm going to say another group separate from this that requires a lot of potential care around this is people who use substances, people who use drugs. Really finding out what's going to make them feel safe and comfortable, knowing that some of their activities are viewed as illegal or criminal or have other stigmas and discriminations behind them. And so that is where some of my background work goes. And it really is about understanding the nuances to their experiences. And I find people are really willing to tell you if you ask from a place of humility and wanting to better understand. And then you can always cite people and quote people in your processes moving forward. But if other people have some understandings around that, please do that. Can we talk a little bit about dealing with someone who is or has become a bad fit on the team and needs to be asked to leave? So this is why we need those guiding values and guidelines in our space, because it is that collective culture element, but also the accountability. And so if we find that someone is being disruptive to the space or creating an unsafe space, I highly encourage conversations and coaching before taking actions. But ultimately, it is also okay for the benefit and safety of others to ask people to step back for a bit. I would not exclude them from being cited in reports or other things, but I would acknowledge that there can be a shift in your team at any time. And it is okay to do that, but I would encourage that to be a conversation with the person first, and an acknowledgement of what's going to create some safety in the space. If you don't have guidelines, it's a great time to create them and to come together and start having those conversations. It's never too late to do that. So we have another contribution, ideas, how to solicit feedback for agenda planning and contributions that are an important part of their journey. Yeah, honestly, that comes from a place of relationship building in my experience, and some key questions, being genuinely curious. If you show that you're curious and create the space for people to share, in my experience, they will absolutely share. Agenda planning can be a little dry, but this is where getting creative with some of your facilitation strategies can be fun. And hopefully next module, we'll get into some of those more fun ways of engaging with one another and looking at that. In terms of accountability and respect for partner time, many engagement opportunities fail to acknowledge or compensate for the time commitments beyond meeting times. I feel that it sometimes decreases my scope of engagement. To Michael's point earlier, to avoid burnout, as it's too easy to say yes. Absolutely. So boundaries are going to be really important for ourselves in this work. And that's where those conversations around capacity are really, really crucial. So from the planning and the outset, we need to be talking about capacity and what it truly means for us to do this work. And honestly, we need to be kind with our timelines. If something needs to be pushed back and that's allowed or able to be done and we have the justification, then please give yourself the permission to do that work because it's going to enrich the project overall. There's nothing worse than spending 6 months doing something and then really it should have taken 8 and it would have been a much different and more robust product, right? And Carrie has offered, when it comes to that person who may need to leave, there's that very relevant comment from our last session on difficult conversations. So if you missed last module, I highly encourage you to check that out. In general, I think patient partners should be involved in all aspects of OHT. More patient partners need to be recruited in some OHTs because existing patient partners can be taxed and spread thin over various committees, projects, etc. So how could patient partners approach this with the OHT and keep this in the forefront? The only thing I have for that is a very transparent conversation and talking about the investment and the expertise that's being shared and the vulnerability. There's emotional labor that comes with this work and with being part of this work, and we need to acknowledge that. And so it doesn't mean that we want to stop being champions or we want to stop exploring these spaces, but it does mean that diversity of perspective and involving others is important as well. So sometimes we do fall into the trap of only having some key players in the space, and that ultimately can lead to burnout or stagnation. And we want to be keeping it fresh. So looking at opportunities and possibilities where people can come together, whether it's new initiatives or new projects or new design days or new ways of engaging, where it's not just those 3 to 5 to 10 people with kind of cycling through all of the OHT's needs. So we need to really look at what are all the opportunities here. And again, that's going to require a little bit of investment. But ultimately strengthens your work. And someone acknowledging that it takes time. Sometimes patient advisors get involved and want to see changes implemented quickly. Any advice on how to best manage their expectations while not squashing their enthusiasm? Yes, be transparent from the beginning. And I really appreciate in the Patient, Family and Advisory Council for the Ontario Minister of Health, they actually have that embedded in their guidelines, that we will exercise patience in regards to understanding that system level change takes time. And so I really think that having real conversations about this is the work and it is important and how can we see change, but knowing that this change is going to take time and talking through what are the barriers to this change without judgment and without blame, but to just say like, there's 100 nurses that need a new opportunity to learn here, and they're all working on different shifts. So this is going to take time and we're looking at about a year or 2 years. And we ask that people are flexible with timelines. All of that can be really important to acknowledge. And so I've answered a lot of questions. It's 12:45. Does anyone else from the team or contributors want to jump in on any of the points so far? I see we've been jumping in on the chat as we've gone along as well. Ooh, I like this from Angie. As a patient family advisor, I need to remind myself of my real capacity. I advise, not command. And vice versa. Everyone in the table needs to acknowledge that we're advising, and this is an organic process. And so we don't command or dictate the space. We don't command or dictate the outcomes. And if we do that, we're going to potentially exclude some really viable, innovative possibilities. And I really appreciate that wisdom. So thank you so much. And someone else has another strategy here. Progress towards the large goal may take years, and maybe we want to measure every 2 months the progress that's made. This is a great suggestion. We want to look at the guidelines written, the surveys that have begun, the data collective. Take time to celebrate your wins. Take time to reflect on your wins. Take time to congratulate each other on the work that's being done. I think that that's so valuable. So on that note, I'm going to close the Q&A. Perhaps just so we have time, we're going to do a little bit of a Mentimeter here. and explore the next steps for the next session. So I encourage you to stick around for this final Mentimeter, because it's going to help us design the next session and see what you would find valuable in terms of engagement strategies. So I'll pass it to Michelle, and you can walk us through our closing slides.
Thanks so much, Alyssa. And just a really big thank you for the presentation today. We're seeing some comments in the chat that people are really enjoying it. It's okay if you do need to take off, but if you can stick around for the last 10 minutes, we just have some feedback questions that we'd like to go through. But just also really want to thank everyone for the engagement within the chat. There's been some great comments and feedback and great questions for the Q&A. And thanks to Carrie for jumping in as well. So I do just want to give a little plug for our next session, which is going to be on May 16th, the same time, 11:30 to 1 p.m. And as we mentioned, this session, we want it to be very interactive to kind of build off today's session with all the content that Alyssa has shared with you. And so we want to get a sense though of like how to design the session. We are thinking it might be maybe different breakout rooms where people can try out different things. And so before we just launch into the Mentimeter, I do just want to try, usually we do this poll at the beginning. And I just want to see if it works. We do like to get a sense of like who's in the room and who's attending the sessions, and that's helpful as well in thinking about the one coming up in May 16th. So I've launched a poll here, and it's just asking what best describes your role. And I just want to make sure, can people see, is it coming up? I see some answers coming in. So I'll just give that a couple, thanks, Carrie. So just give that about 30 seconds or so, and then I'll end the poll and share the results just to give us a sense who's in the room. But I think so far it's starting to be a mix between a patient or caregiver within an OHT or staff at OHT or another organization associated. Okay. So I don't see any more coming in, so I'll just end that and share the results. Hopefully that's showing up on your screen, but yeah, not much has changed. We have some individuals who are patient caregiver with another organization, and a couple of folks as well that are clinician or care providers and researchers or in other roles as well. So thank you so much for contributing to that. So we will go to the next slide, and actually we'll get Junie to launch our next Mentimeter question. So this is what we're really curious about for designing the next session. So what engagement strategies or activities would you like to learn more about in our next session? And this can be anything. It could be from like, you want to learn more about like Jamboards. There's a lot of different types of online boards. It might even be things like learning how to facilitate, or if there's any other kind of tools that you've heard about that you've been curious to learn more about, we could potentially explore that as well. Oh, I like we've got all of these. And we are hoping to try to design it in a way that maybe people can move through different types of breakout rooms, so you get a chance to try different engagement methods that are out there. I'm hearing a lot of all. Even like Mentimeter itself. I know some people haven't always heard about Mentimeter. That's another thing we can do as well. Yeah, great point about the tech limitations. Some are hard to use on patient who aren't familiar with devices such as tablets. And that's actually something too. Sometimes you're using an online tool from your laptop or from your tablet or your phone, and it doesn't always present in the same way on all of them. Facilitating virtual sessions, which is really relevant in these times as some sessions are coming back to in-person or hybrid. Got some comments about compensation, engaging primary care providers. Journey mapping, it's another great one. More on facilitation, capacity planning. Oh, and I see in the chat too, vision boards, it's a good idea as well. Facilitating community events. I'm seeing a lot in terms of like facilitation. And then some other ideas like the journey mappy, the vision boards, or everything. So, okay, so I think I'll just give it another second and then we'll close it there before moving on. And if you don't mind sticking around for just a couple more minutes, we do have some feedback questions about the session in general. And so if you stay within the same Mentimeter within the code, we do just have a few questions that we'd love to just hear your reflections on. And so Junie will go through each of the questions on the Mentimeter, but we'll start with what stood out for you as most helpful in today's session. That many of the graphics and the tables on engagement, the input from everyone in the chat. And thank you again for that. It has been a very engaging conversation. Brave and safe spaces. I'm just saying the range of, let's cut off a bit for me, where we all are in terms of being engaged or not within our experiences. The part where we talked about building trust, the importance of relationship building. And it's nice kind of seeing all these ideas come together as they are pieces that have come from our past sessions and have a lot of relevance when we're talking about getting prepared. Can't pick, most helpful, all was very helpful. Thanks for that. So thinking about the importance of EI and how to incorporate in creating meaningful collaboration. Values for co-design work. Perfect. So maybe we can move on to the next question. Is there anything that you would like to learn more about after attending today's session? Maybe there's something from the content that you want to dig into a little bit more, or spark some ideas about things that you wish you could learn more about. Yeah, now Leslie, you've got them interested in the equip training. More Brain Brown, evaluation of co-design projects. And our last session, the 7th session of the series, will be entirely focused on evaluation. So stay tuned for that. And we can also send that link out after the after today's session for the remaining sessions that we have left. Staff education or skill buildings regarding EDI and co-design. Okay. Thanks for that, Junie. Just saw a question in the chat. Where's everyone answering for the Mentimeter? Establishing a steering meeting. Where do you get the people from? How do you recruit them? Is that something else that you want to just briefly touch on?
Sure. I think that depends on your organization and which structures you have in place. So really looking at who needs to be involved from those different layers of the organization and asking people to be part of it. I think it can be rather informal in terms of your steering process, and then you get a little more formal when you're putting together the implementation and working team. So it can be really informal. If you want it to be formal, you can go through formal recruitment as well. But I think that in general, these are just your planning conversations. So I hope that was helpful and takes some of the pressure off.
Thanks, Melissa. All right, perfect. And we'll go to our last Menti question. So if you can take a moment to just reflect and think about what you've learned today, and if you can provide one concrete example of how you will use this work within your OHT or related activities. So we have creating a safe and brave space for collaborative work. Sharing the braving piece. Yeah, that was a really nice a neat component to think about and reflect on. Be more generous in assuming best intentions of others. Oh, I think it's a question for us to email the YouTube of the session, and we definitely will. We have a follow-up email that will go out after this session. They'll also have a link to a feedback survey. We'll have the recording available and the workbooks again too, just for easy access. Fostering, encouraging, and implementing brave and safe spaces. Today's content will be helpful as we implement an advisor orientation in the near future and our work together going forward. I like the idea of doing a short survey after a meeting or a section just to see if we are on course. It's always great to have those touch points throughout the way. Great. And Sharon, I think it's a comment. You're more than welcome. You don't have to use the Mentimeter. You can also answer it in the chat as well. Totally welcome from all avenues. Okay. So I think we'll conclude there with our Menti questions. Thanks so much, Junie, for launching those. Yeah, and so with that, we're actually on time for ending the session. We do just, as I said, want to get your feedback. This will also come out in an email that we'll send post-session. But if you do have your phone available, you can actually hold it up with the camera function to the QR code, and that will take you directly to the feedback session. Or you can use the link below. Or if you get a chance afterwards, we'll email it again as well. We really appreciate the feedback. This is the first time that we have hosted a learning series like this, so we are continuously learning as our team. Hopefully things have been going more smoothly if you've been attending all the sessions as we've gone along, but we really appreciate your feedback, and if you can take the time to do that as well. And also feel welcome to also reach out to me or Carrie or Jeannie as well if you want to connect that way. More than happy to do that. And then we'll just end off with just giving a big shout out before we go really quickly. There's so many people to acknowledge. It does take a large team. If you've attended each individual sessions, there's always smaller working groups, but we really have a large list of members that were part of our advisory group that put a lot of months together just to even come up with the different sessions and thinking about the overall design of this learning series. So just a big thank you and acknowledgement to everyone who's been part of that. Thanks so much, Carrie. And just with that, I'm going to say thank you again for attending. Thanks to Alyssa. Thanks to everyone who's been so engaged within the chat. And with that, I'm going to wish you well and enjoy the rest of your day and close the session on that note. Thanks, everyone.